Section 5. Isolation. Begin isolation by placing cotton rolls in the center of the upper and lower vestibules. If the cotton rolls are too large, unfold the provided gauze and twist in the shape of a cotton roll. Next, isolate with the gauze included in the Zoom kit. Fully open the gauze squares and fold into a triangle. Place the apex of the triangle into the posterior cheek. Tuck the balance of the material into the cheek, tucking ends between cotton rolls and the retractor. The supplied gauze has been tested and is proven to provide superior protection with the Zoom lamp. Do not substitute your own gauze for this procedure. Carefully place one face bib around the retractor, one side at a time. Add an additional bib for heavy salivators. Liquidam Dental Dam is used to completely protect soft tissue. It is important to ensure that no pink is showing. Twist to remove the cap and attach the metal tip, making sure it is secure and locked into place. Dry the soft tissue and begin by scalloping barrier material to the CEJ area on the upper teeth, slightly overlapping enamel and interproximal spaces to form an enamel seal. This overlap will not affect results as hydrogen peroxide penetrates the entire tooth, including the root. Cure the application of Liquidam on the gingival margin using a curing light like flashlight. Liquidam is a resin blend that can become warm upon curing, so use a sweeping motion, moving light back and forth across the arch for about 10 seconds. Now, change to the plastic tip and fill the space between the cotton roll and the line of Liquidam you just created at the margin and cure. Be sure to cover all interproximal areas, leaving no soft tissue exposed. On lower arch, apply Liquidam using the same method. Use the syringe tip to press lightly on application to ensure it's completely cured. The material should be solid and have no give. If necessary, cure arch again for an additional 5 seconds. The application should extend distal at least one tooth beyond the area receiving whitening gel and be about 2 millimeters thick. Section 6. The whitening procedure. Remove the cap from the room temperature Zoom whitening gel syringe and attach the mixing tip. Now, apply the gel directly from the syringe to teeth about 1 to 2 millimeters thick, using the blue brush provided to ensure proper placement of gel. Raise the back of the chair so the patient is in a slightly reclined position, about a 45-degree angle. Align the light guide to the IsoPrep retractor. Place the end of the retractor into the slots located on either side of the light guide. Begin the Zoom session by pressing the Start button on the display panel. The light will activate and the timer will begin the first 15-minute countdown. It's normal for the light to flicker for the first few seconds. Press the pause button if the session must be interrupted at any time. To reactivate the timer, press only the pause button, or the fourth 15-minute session will be lost. The lamp will beep once when 3 minutes are remaining, and again 3 times just before the session ends. When the time reaches 0, the light will turn off and a long beep will sound. Be sure to check on the patient regularly during the whitening treatment. If you plan to leave the room for an extended time, provide the patient with a means to contact you, such as a small bell. It's also helpful to have a paper and pencil available in case the patient needs to communicate. After each 15-minute session, remove the light guide from the retractor and gently pull the lamp away from the patient. Avoid changing the angle of the lamp arm or head to minimize readjusting for each session. Next, carefully remove the gel with the surgical suction tip and check the isolation materials to ensure no pink tissue is visible. If the patient notes irritation at the margin, use vitamin E oil to soothe tissue. If the patient notes tooth sensitivity, apply the Relief ACP gel on lingual surfaces for remaining sessions. The Relief ACP gel is provided in the patient post-care and maintenance kit. Reapply the Zoom whitening gel. Align the light guide to the IsoPrep retractor and begin the next session by pressing Start. Repeat these steps for each of the 3 sessions. For patients darker than A3, or if it's deemed necessary, a 4th session is available. Be aware that additional sensitivity may occur and patient comfort should be assessed and taken into account. Point out to the patient that the progress of each session will be tracked by the 4 lights on the top of the lamp head. A light will appear for each quarter of the session. These lights are also helpful for checking on the patient's progress and time remaining. For sensitive patients, it's recommended to use the included Relief gel and incorporate the optional Zoom Light Guide extender. The Light Guide extender is available from your discus representative. To attach the Light Guide extender, pull back the lamp head and attach the Light Guide extender over the light guide while making sure it's not detached from the lamp head, or the session will be canceled. It's important to note that using the Light Guide extender may reduce results. Therefore, a 4th session may be needed. Section 7. Isolation Removal. Remove the light guide from the slots and gently slide the lamp out of the way. Use the surgical suction tip to remove gel from the teeth. It's very important to moisten the gauze and cotton rolls before removal to prevent tissue irritation. Use the cotton pliers to grasp gauze and cotton rolls, then gently pull the material out. All of the isolation materials should pull free from the mouth in 1 unit. Completely rinse the teeth and irrigate the oral cavity. If liquidam remains interproximally, remove it with floss. Section 8. Post-treatment. Now it's time to assess the whitening results. Reinsert the retractor and take a retracted after photo with the lighter shade tab in place. Measure the shade change by counting the shade shift according to the value ordered shade guide. Be proactive. Don't wait for sensitivity to occur. Dry the facial surface of the teeth with gauze. At this time, the teeth are dehydrated and may be sensitive to air. Relief ACP has been shown to decrease sensitivity and remineralize teeth. Place Relief into the take-home trays and seat on the patient. Normal wear time is 10 to 30 minutes. If trays are not available, brush product onto the teeth. Instruct the patient not to spit for approximately 3 minutes. Review the post-treatment care instructions with the patient. Explain that the teeth are more susceptible to restaining over the next few hours. The teeth may continue to lighten during this period, and the patient must be careful not to consume any staining foods or beverages for 2 hours after Zoom treatment until the pellicle reforms. All tooth whitening requires maintenance. Personal habits that promote staining, such as smoking or coffee and red wine consumption, will affect how long whitening results will last. We recommend patients use the whitening maintenance kit provided to maintain the results following the Zoom procedure. Some patients may elect to do additional Zoom treatments, but allow at least 7 days between treatments. Depending on your region, Zoom kits are available with the following take-home options: Night White ACP, 22% carbamide peroxide; Day White ACP, 9.5% hydrogen peroxide; or Night White ACP Turbo, 6% hydrogen peroxide. Section 9. Cleaning and Storage. Use any standard quaternary ammonium, phenolic-based disinfectant, or alcohol to wipe down your Zoom lamp. Do not spray disinfecting agents directly onto the unit. Do not use glutaraldehyde to clean your lamp. Such materials can damage the coating surface. When the lamp is off, check the glass in the aperture to ensure no residue from the cleaning fluid remains. Section 10. Tips and Troubleshooting. If the light will not turn on, or if the light guide is not in place, the display will continue to read Attach Guide. Use of the light guide is mandatory to maintain proper distance to the light and maintain positioning at the smile zone. When using a curing light, always cure the liquidam in a sweeping motion. If the light is held in one position too long, the material can heat up, causing discomfort to the patient. Fully recline the patient during the liquidam application. This will help in making sure the material does not run before it can be cured. Dispensing the liquidam using the metal tip can be difficult when using your thumb to depress the plunger. Place the plunger against your palm and pull the barrel with your index and middle fingers. Once the isolation is complete, always check the margins and interproximal coverage of the liquidam, especially on your blind side. Remember to use the rule, no pink. Use the vitamin E oil to soothe any sensitive or blanched tissue from contact with the whitening gel. If there is a concern about excessive sensitivity and ibuprofen is needed, do not exceed 1,200 milligrams within a 24-hour period. The smallest effective dose should be used. Consult a doctor for full prescribing information, warnings, and cautions. Stronger pain medication can be prescribed if needed. After the procedure, the bleach trays can be used to deliver additional relief ACP gel to the patient. The isoprep retractor can be trimmed using the slow-speed handpiece to maximize patient comfort. However, ensure tissue remains protected from the light. The isoprep retractor provided is a universal size that should fit most patients. We recommend ordering small isoprep retractors to have available in your office in case it's required by your patient. Small isoprep retractors can be purchased by contacting your discus representative. Section 11. Marketing Support. Now that you've got your new Zoom system all set up and ready to go, it's time to spread the word. Discus is committed to helping you drive your Zoom in-office whitening growth. In fact, it's one of the many benefits of buying from Discus. We provide a number of Zoom marketing services and materials that can be customized to fit your practice needs. For more information about marketing Zoom to current and potential patients, call your Discus representative today.